Hi, and welcome to SYCL 360. It's my pleasure today to introduce Dr. Ann Gronowski, Professor of Pathology and Immunology and Obstetrics and Gynecology at Washington University School of Medicine. Dr. Gronowski is also past president of the AACC, and I'm also happy to introduce Dr. Nicole Tolan.
Thanks, Joe, for having me. I'm really excited to have this opportunity. We've been able to essentially pair up SYCL 360 and the SYCL Mentoring Moments initiatives of the SYCL Core Committee. We've asked SYCL members to post questions for your SYCL 360 on the artery. And today we'd like to pose those questions to you and learn a little bit more about what you've been doing as far as mentoring young clinical laboratorians and some of the research interests that you've been able to work on in your career. So thanks for being with us, Ann. Today, I think the first question is to learn a little bit more about this professional development group for women that you've initiated at Washington University. I understand that this has been a long time coming, and that we'd like to learn a little bit more about that program, what resources you may offer in that program, and maybe even a little bit about ways to seek out such a professional development group if one does not exist at a particular institution.
Yeah. Well, thanks, Joe and Nicole, for having me here. It's really a pleasure to be here. So yeah, we started 5 years ago a professional development group for women within our Department of Pathology at Washington University. And the reason I started it was when I joined the faculty at WashU, there were no women faculty in our division. And since then, I'm happy to say we have more women, and that's great. But when I achieved full professor, I really decided that I didn't want to ever be the only female in the department again, or in the division. So I formed a professional development group that would hopefully make it so that the women that we did have there would be successful, either trainees or faculty. And it was actually, I have to give a shout out to Paula Santrak at Mayo, because it was kind of formed after a group that she started there. So we've been in operation for about 5 years. It's a small group. It started with faculty, and it's grown into faculty and trainees. And we cover a lot of different material. We do articles and books, and talk about things like negotiation, difficult conversations, unconscious bias, a lot of topics that are perfectly applicable for men and women. And I think everyone should read a good book on negotiation, no matter who you are. But we really created a kind of small, safe environment for women to talk about some of these issues, in particular as it pertains to women. So let's say negotiation, for instance. A lot of studies show that women don't negotiate. And when they do, they're perceived as being pushy or whatever. And so we talk about those things, and then we have a safe space for women to talk about, personal questions or issues that they've encountered. So it's been really successful. And the second part of your question was kind of if somebody wanted to do this at their own institution, how could they do that? We published a paper about our findings and the feeling of the perception of success for it. And that was in the Journal of Applied Laboratory Medicine, published in November of 2018. So the recipe is there if one wanted to start it at their own institution, but it doesn't have to be anything that formal. You could start with just coffee and a few of the women in your department, or kind of a power walk a couple times a month. Or if you don't have a big enough group of core women, then form kind of a conversation group among different institutions. So I think there's a lot of ways that you could do the same thing, but it's been really rewarding.
One of our SYCL members, Chessie Woma, had actually asked a question in relation to that. Being a woman, can you describe a little bit more what your recipe for success is in your career as a clinical chemist?
Yeah, I wish I had a recipe. That would be great. I would write it down and I would sell it. I'm not sure that there's a single recipe. I would say that tools like we cover in our professional development group are great. So understanding about negotiation, understanding about difficult conversations. There's some great books out there. Lean In by Sheryl Sandberg. How Women Rise, I think, is another one. So educating yourself is a great start. But then I think she also asked a question about kind of organization and multitasking, and that I would say has been, for me anyway, key. I have twin boys who are now 18, and when I was AACC president, I think they were like 10 or 11. And so part of, I think, anyone's success, male or female, and whether you have kids or not, is multitasking and being organized. So creating a list of the things that you need to do, then prioritizing that. And then for me, I just bring work everywhere. So if I'm stuck in traffic, I can check something, or if I'm stuck in a doctor's office or on a plane or delayed, I can do some work as well. So, so I think it's multifactorial, but I wish that there was a secret recipe.
So following up on that, another SYCL member, Dustin Bunch, who will be starting his first position out of fellowship, would also like to know, what is something you would have told yourself when you started your first position?
That's such a great question. So I think I would have told myself a couple of things. One, I think especially for medical director of a laboratory, is go and shadow every bench. Get to know every single person in the lab, the process within the lab. And then kind of along with that is ask questions. Don't be afraid to ask. I think I was definitely like, gosh, if I ask this question, they're going to think I'm stupid. Now is the time to ask the stupid questions. And then I guess as a corollary to that, have a little bit more confidence in yourself. You're smarter than you think. Go ahead, ask those questions, because they're probably good questions, and maybe they're uncovering something that maybe could be done better in the laboratory. So those would be the three things I would tell myself.
Excellent, thank you. Looking at Janetta Briskin, who asked, what advice do you have for SYCL members who have limited resources for doing research but want to contribute professionally?
That's a really good question. I think most of us in lab medicine have an appointment that is more clinically oriented as opposed to research. So a bigger chunk of our time is meant to go clinically, which means that we're not bringing in a ton of money to do research. And so we operate on a shoestring. So I think we're all in that same boat. I think there's a number of things that you can do. First of all, you can still publish even though you aren't doing, primary big basic research. So clinical case studies, reviews, chapters, things like that, Q&As, that's low-hanging fruit.
And what's your guess is my favorite.
Yes, what's your guess is super easy, right? Because it's a 75-word case, a couple of questions, 75-word answer, which is a great lead-in to the fact that you don't have to sit around and come up with some great, profound, basic research question. A lot of my own publications have come out of cases that I've seen, interesting cases. In fact, a big area of my research is HCG, and that's many of the avenues that we've gone down have been just things that came out of clinical cases, something unusual we didn't understand, and so we pursued the answer to the question. And then I would say, I think other tips are collaborate, because you may feel like you don't have the tools to do something big, but you may provide a really important cog in a bigger, set of wheels that can allow someone else to do some research. So collaborate with people. And then don't be afraid to have a number of areas of research. I think you should try to pursue things that interest you, but a lot of my things that I've worked on just dried up and blew away. So I had different areas of research, and some of them grew and flourished, and some of them didn't. So it's okay if you have a number of different things that you pursue, and some of them will go someplace, and some of them might not. So that's okay.
Another question that Chessie Voma had posed was, where do you see laboratory medicine, specifically clinical chemistry, in the next 10 to 15 years? And Mustafa Barbuya had also asked a little bit about maybe the role of artificial intelligence and data informatics, and how do you see the horizon for our specialty?
That's a great question. My husband's an attorney. Before he was an attorney, he was a pharmacist. And a lot of people said about the field of pharmacy for many years, oh, well, now we have automated pill counters. We're not going to need pharmacists anymore. The profession is going to dry up and blow away. And if you looked at the field of pharmacy, it's flourished, and actually now you're not a registered pharmacist anymore. You're a PharmD. You're a doctorate. They're in pharmacies. They're giving shots. They're actually doing lab testing.
Yeah.
And I think that clinical chemists, the field of laboratory medicine, is a lot like pharmacy in that we're an ancillary health profession. We provide help to physicians in diagnosing patients. And I don't see that changing. So I think that in 10 to 15 years, a number of things are going to change about our jobs. Silos are coming down. I mean, in my own career, I was trained as a clinical chemist. I've overseen microbiology, infectious disease serology. Now I'm doing some more coag kinds of things. Wow, who would have thought that? So I think we might need to broaden our training. And another area is artificial intelligence. So whether it be digital pathology or computational pathology or whatever, data mining, laboratory medicine sits on a huge mound of data. We've been generating numbers since, the 1950s, and many of us, at least of my generation, aren't qualified to really sift through that and make sense of it. But I think this next generation really is qualified to do that, and we need to own that. It needs to be within pathology departments. We need to get the right people there to synthesize that data and see what we can make of it. So, in the future, I see us being still employed and still valuable. So, of course, laboratorians are going to help develop tests, right? So we've got industry and the development side. We've got the consultative role. I don't think that's going anywhere, no matter how automated the lab gets. But then I think really new roles, this artificial intelligence, and it's our job to be able to pose the right questions. What questions should we be asking? So even if you don't know how to do the artificial intelligence, the computational part, knowing the tools that are there and how they can be used to answer particular questions, I think is really important. And then be well versed in, well, what are the ethics of that? What are the limitations of that? Because it's not going to be just like any other laboratory test. It's not going to be perfect, right? So we have to understand the limitations of that. So I think the future is really, really bright, and I think that we're going to be all employed. It's just our job roles might change a little bit.
Excellent. And the last question I'll lead into, Ann, is what was the last book that you read? That's my question, I have to admit. So what was the last book that you read, and what perspectives did you leave with?
Yeah, so I'm going to answer with 3 books, okay? The truth is the last book I read was Agatha Christie's And Then There Were None, because I like to read some good, solid, classic books. And that certainly the take home for me was that the classics are always classics, and they're classics for a reason. The last book that I read that I really that sat and was profound to me was The Hate U Give. And I'm from St. Louis, Missouri, where we had the Michael Brown shooting. And The Hate U Give, it was a book that was assigned in a book club, and originally I thought, I'm really not interested in reading this, doesn't look up my alley. And I really enjoyed it, and it really resonated with me and changed my perspective. And then I will say probably one of the best books I read as far as day-to-day is a book that's geared towards women, but I think anyone can read it, and it's called Ask For It. It's a book on negotiation. It's geared for women and how to negotiate, and that's something I use probably every single day. So you got 3 books for one there.
Wow, excellent. That's a great deal. Thank you so much. And again, thank you everybody for watching, and thank you, Nicole, for helping moderate the discussion.
Thanks for having me.
Ann.